Okay, welcome in. Today's meeting is briefly to discuss L-Jelly Bean efficiency, how to better utilize the L-Jelly Bean and just options for your workflows that you can play around with you and your team. So as you can see, this is my L-Jelly Bean here. It shows I've got 4 labs. Every once in a while there are hidden labs here. L-Jelly Bean will say 1 or 2 labs and there's nothing in your box here. Frequently that is a dating issue. So these test labs were ordered on a patient from 4 of 15, so they weren't initially showing up. So just to kind of show you, you can actually change the dates of the view of the labs you're looking at. So every once in a while you'll have a future lab that you ordered and got done, and somehow it doesn't show up in your box yet your L-Jelly Bean is showing that you have a lab, a phantom jelly bean, if you will. And so that's how you can potentially search those down, is by changing the dates of the slice that you're looking at. So that's one thing, and your L-Jelly Bean always defaults to be reviewed. Those are the labs that are recently received and ready for provider review, and those are what will show up in your box as the provider. You can review all outstanding labs, reviewed labs even. So let's say you kind of get through a whole stack of labs, but you wanted to briefly look back on one. You can click on reviewed and go back and look at labs that you've recently reviewed. You can look at future labs, you can look at labs by patient, you can look at canceled labs, you can look at all views. So this would be your outstanding, your futures, your everything. Most of the time it just defaults to be reviewed, and that's how beans get managed. So this is kind of the view, as I said, once you open up your lab. I'm going to go ahead and change my dates here in order to reflect 2015, just so you know. So now you can see my test labs here. So once I go ahead and open up a lab, there are multiple ways to view labs, as you may know. You can click on them individually by clicking here. The other thing is, if you can put a checkbox here and you can do view all reports by visit right here. And if you just check the one box for, there you go, you have to hit the arrow next to view all reports. Then it'll pull all results for that patient. However, these are test labs, so they're not popping in here. Hopefully you're familiar with this. I think most of you use this view. I personally don't, but it's reasonable. I think it's not showing anything just because we haven't put in any results here. Actually, let's go through and maybe put in some results. So you'll notice I can hit the next button. When I hit a result, I can hit next, and it opens up the next lab in the sequence. That's kind of my preferred way to flow through labs. And so once I throw in a result on each one of these, I wonder if my cumulative view will now show. I may actually also have to have something along these lines in the actual result fields in order for that cumulative view to show up for you. Let me just throw these in here. Again, you also have the next review button, or the previous review button. So previous takes me back to the lab, but keeps the labs open. If I hit the next review, then it actually reviews this lab and goes to the next lab. And so it review meaning closing out the lab, and so it disappears out of your L-Jelly Bean and just goes and gets saved in the patient's chart. So now if I put a checkbox in the patient's name and I go to view all reports by visit, looks like I'm still not seeing anything here, but that's okay. You guys know what this view looks like. One thing that's kind of cool about this view is you can actually add multiple things. So I can timestamp, I can review kind of the full series of labs and write kind of a generalized statement around what the labs mean. Whatever you want to put. And then you can actually apply your summary statement of all these to every single lab, which might look kind of funky. Just depends on your style, but it's reasonable to do because now each lab has the same kind of summary statement. So if I hit apply, then I can assign these to my team. If they're not getting closed out immediately, I can click in results. If they were all normal, I can click normal. And now I can go ahead and click they default, you can post in the progress note right here. They default to be published onto the patient's web portal, so you don't have to worry about that. Then I click apply all, and now it applied everything I wrote in this box, and this box, and this box to all of the labs in the list. Again, being that these are fake labs, we're not getting any fields, but that's okay. But it will apply everything in that list. You can kind of play around with that. That's one way to do kind of multiple labs at once. Once you're still within that same view, it should be noted you still have access to the patient's hub right here. So one workflow that I know a lot of teams are kind of honing in on is creating one web encounter or one lab encounter per a battery of labs. So if I have 4 or 5 labs, instead of sending 4 or 5 labs to my team to now communicate to the patient, if I'm not going to do the communication myself, one thing that some teams are getting a little more savvy about doing is creating one lab results summary. And so you can just click normal, abnormal on each lab, and then kind of write your summary of the battery of labs in this view and send it to the patient or the team. So from here, I can click a drop down and click lab results. And then if I write my results down here, I have the option of posting it to the patient's portal. So you can write it in a person that is directed to the patient. So now I can go ahead and write, hi Chris, your recent lab results showed ... and then I can click reply to patient. It'll say, do I want to save it? I'll say yes. And now I've created kind of an email looking message which I can now send to the test patient here, in which the patient will now get a notification that they have an email on their portal. If they have the Helo app, they'll get a notification on the app on their smartphone that they have a new message from their doctor right there, and they can open it up and read the lab results right there. So that's one methodology for communicating back to patients through the portal. The other option is you can write a message to your team if the patient's not terribly portal savvy, or clinically you don't want this necessarily just left on their portal. You'd like to actually get them acknowledge the phone call that they received these results with a further plan if they need a medication or whatnot. So from here you can just obviously resend it to your team and write the message on what you want them to communicate to the patient. There are a myriad of ways to use a telephone encounter to communicate lab results. So through the action taken box, you have access to I've created a bunch of templates myself. You can make your own, but you can create templates on different types of lab results. So GDM normal, H. pylori Spanish, H. pylori positive. So if I hit clear here, my H. pylori positive in Spanish, hola, usted tiene una bacteria. So then you have a message in Spanish that I could post to their portal. I would still post, probably in that case, since I'm starting them on a medication for their newly diagnosed H. pylori, I'd probably send a portal message, which I'll go ahead and do, reply to patient. You can see how that kind of looks on a message. I can send that to the patient, and now I can go ahead and timestamp and say, team, please make sure this patient got above message I sent to their portal, and let them know their prescription is ready. So that's just sort of a further kind of way to handhold and make sure your patients get all loops closed, but it also briefly, really fast, you can, with just a couple of clicks, post a message on their portal and get them utilizing their portal. I think that is ideal in many ways if you have a portal savvy patient. So that's kind of one way. Now from here, there's also actually a way from telephone encounters to merge templates. So if I go ahead and close this patient's note out, and now I have this telephone encounter message that is not closed yet, I can actually go to templates, and I have a template that's called H. pylori treatment that I can merge onto the telephone encounter, and now you can see the telephone encounter now has medications on it. So if I reopen the telephone encounter, I now have medications on my RX tab that I didn't have to search for, and I can hit send prescription once I have a pharmacy and go ahead and send it that way. So there are ways to use templates on telephone encounters that can be pretty powerful. Just wanted to show you that briefly, but back to labs. Here on my lab results for this particular patient, here they all are. Again, one methodology is I showed you the cumulative view. Now the other way is you can kind of interpret each lab right here by clicking this browse box, and you have a number of star CHC options for different types of results that come in English or Spanish or both. Probably should potentially maybe break them down into different English and Spanish, but this has kind of worked well for me so far, and for several folks I know are using this. You can hit a star CHC normal CMP, and then it has the first line is in English and the second line is in Spanish. I'll frequently just leave it as both. And now, brief important piece about utilizing this field. This field is visible to all patients, and so on their portal, and so this really should be used for patient communication, lab-specific details. Any internal communication about call patient, about this, that, the other should be done in internal notes. And I realize there's not a timestamp on that, which limits it somewhat, but I do think that that is important. When patients open their lab results on the portal, it's probably not the best thing for them to view. Called patient 3 times, called patient now, left a voicemail, patient not answering. It just kind of clutters what they're viewing and isn't necessarily clinically relevant to them and may discourage some portal activity. But if you have direct patient language and communication about results right there, that can be pretty powerful. And again, once I review this, I can put in my interpretation in the lab right here, mark whether it's normal or abnormal, and I suggest you just kind of write normal or abnormal in these fields because you can see them later. And then I hit next review. It opens up my next lab in the series. Timestamp, browse. What was this lab? I believe it was a lipid panel. So we have a normal lipid panel result right here. Again, here, click next. And now once these labs get reviewed like this, once a lab gets reviewed, the patient does get a portal message stating that they now have labs available to view on the portal. So, it depends on what your practice style is. If you want to now go out and ping the patient through sending them a portal message, or just rely on this review function. Once I click review on a lab, and hit next, or hit next R, which automatically clicks the R for me, that posts to their portal. You don't necessarily need to send them a portal message otherwise. Now, I guess one other methodology for notifying the patient is now once I click next review, next review, next review, and I've interpreted their labs right here, I know they're a fairly savvy patient. They've sent me portal messages before, and I'm comfortable leaving their lab results in that fashion. You can click Messenger here and send them now a portal message. Lab results on portal right here. It says your lab results are now available on the patient portal. Please log in, and it has the link right there that they can click on from their smartphone. If they have internet connection on their smartphone, they can actually look right there, or just call the clinic to get your lab results. And so you can do that in English or Spanish. And then it's important to know that, and you can see that in the orange field right here. It says language, English or Spanish typically. And then I can go ahead and click send a text message right there. Hit the arrow next to SMS text, hit send, and now I've texted them after I've sent all their results. Now there is a setting in which the patient does get a text message the day after their portal messages get resulted. So that is there as well. So really, if you're clicking through and reviewing results, they get a portal message and they get an SMS text message about their results are on the portal. You can decide individually how further you would like to communicate with your patients about this. But just know that those fields, where those fields view, how you can do that. And then through the again, Hub, you can do multiple lab results you can summarize into one web or telephone encounter out through Team. The other advantage of utilizing a new telephone encounter is you can send a prescription, merge a template onto the telephone encounter, do a couple of other powerful things which telephone encounters are able to do. So that's kind of lab results, how to some management options in order to get through your labs in a more efficient way. Hopefully that was helpful. Please send along any questions. Ben, do you have any questions? Anybody else have any questions? Anybody else on?
Nope.
Okay, hopefully that looks fairly familiar as we've gone over that before. And that's all I have for today.
Okay, thanks.
All right, okay, talk to you later.